If one broke his finger, let's say?
Yeah, it's a plastic surgery specialty.
So he doesn't go to an orthopedics, he go to a plastic surgeon?
It is a mixed, but it's a part of our program to do hand surgery. To do hand surgeries
as well, even if it was a burn or a fracture or anything?
Whatever. It's a tendon injury, vessel injury, or fractures, we deal with it.
So it's a subspecialty out of plastic surgery then?
Yeah, it's a part of the program, and you can get different subspecialty in hand, either congenital or adult hand subspecialty.
Dr. Bishir, we saw today the report about Shake Your Body and how to lose weight. And basically, a huge population around and everywhere in the world have excess body weight, let's say, or overweight, let's say. Do you have males coming for liposuction?
People think that the easiest way is to do liposuction.
Mm-hmm.
It's actually liposuction to start with. It's for just getting the excess, not to lose weight.
Yeah.
This should be completely understood by the patient who comes to plastic surgery. Curbing the patient. It's not a matter of just doing a liposuction for weight loss. Usually we've got different procedures for weight loss. We refer patients to dietitian, to general surgery. If they are morbid obese, we refer them to general surgery for
the ring, let's say, in the stomach.
Ring, or which is called the band, or bypass surgery. This is not our part. We come after that. You come when they lose all their weight? When they lose the weight. Yeah. We do the reconstructive part. If they've got an excess skin, yeah, we do the surgeries for example, abdominoplasty, removal, brachyplasty, which remove excess skin in the arms. We do some thigh lifts. This is a part of a plastic surgery. It's a reconstructive. Now it's a reconstructive rather than aesthetic. Post-weight reduction surgeries. And you can do it in any part of the body, in the face, in the arms, and the thighs, everywhere where there is where there is excess skin. Generally, this is post-weight loss. And what do you do with the excess skin? Can we make a drum out of it? Should be thrown. In all means, what we do actually is it's to make it as normal as any patient, as any normal person. We do excess skin excision with a limitation. We don't go for excess excisions, only with the limitations. Wonderful. So right now, we just clarify to the people, when seeking for liposuction, they should always come at the end stage after they lose as much as they can lose weight. And you guys remove the excess only. There's another point. Patient with excess weight has a problem, more risk of a complication during the surgeries, and especially plastic surgeries. Mm-hmm. They come to you for aesthetic point of view, and they end with dramatic complications. They have a difficulty in wound closure. They have a difficulty in sometimes pulmonary embolism, but generally. To be cautious, generally, a plastic surgery is the last point in modeling or curving the patient. So you always study the patient's file and his situation before always doing a surgery, and every time you have a surgery, you always have to speak to the patient. And what if the patient refused and he was insisting in having a surgery? Generally, the surgery which you are not convinced with, you have the right to refuse. Mm-hmm. Wonderful. But that's in governmental, let's say. Yeah, even in private, if one or two surgeons are doing that, it doesn't mean that this should be done. Yeah. The standard thing is not to do the patient only wishes. Yeah. Which is right for the patient. Imagine that this patient is your brother. Would you insult him, putting him in the surgery for non-reasonable surgery? Have you faced any situations regarding this, patients trying to insisting on having the surgery while they don't need it? Yeah, we have a lot. We have a lot of these patients. We refuse, not only refusing a patient to be operated, we advise them not to go anywhere, even if we refuse. Because sometimes you are stuck with a patient that he's going to do it, either you or somebody else.
Do you refer them to any other place, let's say, other clinics?
Generally, if patient has some psychological elements, we refer them to psychiatrist or social worker to evaluate, generally to evaluate them and let them give proper advice.
Wonderful. So, doctor, you're changing the idea of plastic surgeons. This is very wonderful. Dear viewers, right now, plastic surgery is not only to make you more beautiful, which it's a common known to everyone, but now you can always gain more information from this episode, because we're trying to deliver a message to everyone. There is a huge reconstructive part in plastic surgery, which is missing to all people. Alhamdulillah, a lot of us doesn't need reconstructive, but people having accidents, going through burns or anything might need the reconstruction, and this is very important and useful for people. And here comes the role of plastic surgeons when it first started. Dr. Bishir, about male rhinoplasty. A lot of, or let's call it in the slang, the nose job. People call it nose job, okay? And in medical terms, it's rhinoplasty. Male rhinoplasty. Is it sometimes reconstructive and sometimes aesthetic?
Yeah, as we said before, if it is a post-traumatic nasal deformity, it's a reconstructive.
Okay, and do you try
to turn it back to normal?
To normal.
Okay. There's some noses that they have a deviation in their septum. They have a really deformed nose to start with. That we would think that is a reconstructive more than aesthetic. But in general, nose job is very delicate area to deal with. And we have to say a very important point in this. The nose is something racial. The African nose has a special category. Asian nose has a special category. You cannot make a Caucasian nose for our noses here and to say that this is a normal. It depends actually to the patient where he lives.